Kidney stones can be treated via multiple modalities depending on the size, location, and sometimes composition of the actual stone. Treatment modalities such as observation with medications and ample hydration, called medical expulsive therapy, may sometimes be used. Other treatments may include extracorporeal shockwave lithotripsy, or ESWL. This treatment consists of a machine being placed next to the body on the side that is affected, and using shock waves, the stone is somewhat pulverized and the passage of the stone is more simplified. This does require anesthesia, but is an outpatient and rather quick procedure usually. Other treatments may include endoscopic treatments, and in those instances, the urologist may take a small camera and go up to the tube or inside the kidney itself and break up any stones that need to be reduced in size and take them out using different types of devices, sometimes baskets. Other treatment modalities may include something called percutaneous nephrolithotomy, which is a treatment where a small opening is made in the skin next to the kidney, and a tract is developed directly inside of the kidney. And using this larger access, bigger stones can often be treated in one setting. This sometimes does require hospitalization and drainage tubes, but it gives patients the best chance of stone clearance, especially if the stone is large. Other modalities such as robotic or laparoscopic surgery could help with much larger stones or staghorns, and open surgery may sometimes also be indicated depending on the surgeon's experience.